state legislatures through a variety of formats and approaches. The ongoing NCSL-NHTSA relationship has bolstered NCSL's base of expertise, which is critical to state legislatures in their consideration of traffic safety improvements. We are fortunate to have 4 distinguished speakers today from the National Highway Traffic Safety Administration and from the California Office of Transportation Safety. After all 4 speakers present, we will have time to accept some questions. If you have questions for one of the speakers, you may at any time type it into the question box on the right hand of your screen. Our first presenters from the National Highway Traffic Safety Administration will give a background on the evolution of performance measures. With us today, we have Tom Luzo, the Regional Administrator for NHTSA Region 2, which includes New Jersey, New York, Pennsylvania, Puerto Rico, and Virgin Islands. Mr. Luzo is a recognized highway safety professional with an accomplished career in highway safety. Prior to joining NHTSA in 1977, he worked for the New York State Department of Motor Vehicles Driver Improvement Program and as a teacher in New York City. In 1988, he was appointed Regional Administrator. For the past 4 years, Tom has worked closely with the Governor's Highway Safety Administration to improve the administration of the state and community highway safety grant programs, and he has been recognized twice as NHTSA's Employee of the Year. Also with us from NHTSA is Barbara Sowers, Program Manager, Office of Regional Operations and Program Delivery. Barbara is the Director of the Office of Grants Management and Operations with NHTSA. She oversees the planning, development, and deployment of the NHTSA Highway Safety Grant Program. In addition, her office is responsible for oversight of the grant program, technical assistance, and training. She holds a Bachelor's of Science degree in Health Science and a Master's of Policy Sciences. She has been with NHTSA for 25 years, serving in various capacities, including national organizations outreach, communications, impaired driving prevention, and pedestrian safety. Please welcome Tom and Barbara.
Thank you, Ann, and many thanks to the NCSL members. We truly appreciate the opportunity to make this presentation today. I would also like to thank my colleague, Tom Luzo, and the California Office of Traffic Safety, both of whom will provide real-world examples of how this actually works. So let's get started. Next slide, please. While performance measurement has been a familiar and frequent topic between NHTSA and the states for the past several years, data-driven and evidence-based programming is now required as a prerequisite for state highway safety plan approval. Given that each state must provide documentation of its current safety levels, set measurable targets, and justify why and how the target is appropriate and data-driven, this webinar will describe the minimum performance measures and explain what makes a target. Tom will talk about the art and science of goal and target setting. He'll explain the methodologies, and he'll show you a couple of examples. Next, you'll hear from the California Office of Traffic Safety about how they implement the measures as well as the benefits they're realizing. We'll close with suggestions on how you can help states move forward in meeting their targets for safer roads and communities, and then we'll take your questions. Next slide, please. Why use performance measures? Well, the answer is obvious. We have to. But beyond statutory requirements, agencies and organizations use performance measures and goals to define what to achieve, to drive innovation, and to improve accountability and transparency. Performance measures and their associated goals can help agencies do many things. Several are listed here. Measure program effectiveness, utilize resources more effectively, enhance decision-making, justify future activities, and validate progress. In addition, agencies can improve the quality of service provided to the public, document and communicate agency goals, priorities, and objectives, assess, document, and communicate performance, strengthen accountability, and assess the effectiveness of new and existing policies, practices, and procedures thus allowing comparisons to agency benchmarks. Clearly, Congress saw these benefits and as a result made performance and accountability central tenets of our MAP-21 legislation. So let's recap the new requirements. Next slide. States submitted their fiscal year 2014 highway safety plans, also known as HSPs, on July 1st of this year. The HSP must include performance measures. This means documentation of current safety levels for each measure, quantifiable annual targets for each measure, and a justification for each target explaining why it's appropriate and why it is evidence-based. For fiscal year 14, states must use these performance measures. Previously, they were voluntary. The measures were jointly developed by NHTSA and the Governor's Highway Safety Association. Next, we'll take a look at the core measures that were effective beginning, but not mandatory, in fiscal year 2010. And to do that, I'll turn the presentation over to Tom Luizzo.
Thanks, Barbara, and good afternoon, everyone. It's really an honor for me to participate in this webinar today. Well, next slide, please. As Barbara mentioned, in 2009, NHTSA and GHSA undertook a project to define common performance measures. The Office of the Inspector General and others were really, encouraging NHTSA and the states to come up with common ground and common measures that we can ask every state to provide. And these measures, were to be specific, measurable, achievable, results-oriented, and have a time element attached to each. Up to that point, each state was evaluating their programs in a variety of ways, and this was looking to make things more consistent across the nation so that we could look at every state using the same yardstick. And so these were, realistic measures that were all agreed upon. These were core performance measures, and I'll describe them on the next slide in a second. But basically, they were measures that we were using now. They were practical, they were readily observed measures and things that every state was doing. And that was the agreed agreement that Barbara mentioned between GHSA and NHTSA. And these were reasonable. This wasn't going to cost an awful lot to do this from a resources standpoint. So now let's look at those 14 measures. Next slide. I mentioned there were 14 measures. We have 10 outcome measures. I've highlighted the first 3 because overall fatalities, serious injuries, and the fatality rate per 100 million vehicle miles of travel, those are 3 common measures between the highway safety plans and the Highway Safety Improvement Program that is administered by our sister agency, the Federal Highway Administration. Every state in America has a Highway Safety Improvement Program. And what MAP-21 did, it was it asked the states to be consistent when we were using goals and targets in each of these plans. And so we have a strategic highway safety plan that makes this mandatory for the 2015 plan. So we're about a year out. But those are the 3 common measures identified so far. And there may be more. And so we have the rest of the outcome measures. We have one behavioral measure. Every state does a safety belt usage survey, typically around May, June in the summer. Some do it a little bit later. And they report that belt use rate to NHTSA for everybody to take a look at. And then 3 activity measures, citations for safety belt, speeding citations, and DWI arrests. Now we're asking the states are required to report on those 10 outcome and 1 behavioral measure and to set targets for those 11 measures. And they're asked to report only on the activity measures. So we're not asking states to set targets on those final 3. And there'll be more in the future. The states also do attitude and awareness surveys. We're looking at speed monitoring and also another measure for enforcement activity, but that's down the road a bit. All of these measures are based on FARS data. This is the Fatality Analysis Reporting System, a census of all fatal crashes in America. And so they're common to every state. Every state participates in the FARS program. The only one that doesn't come from FARS are the serious injuries, and that we get from each state. And that's going to pose a challenge for everyone, NHTSA and FHWA and the states in the future, in coming up with a common definition for that one. And so we'll be hearing more and more in the next several months on that. And the VMT, the vehicle miles traveled, that comes from FHWA. But everything else is FARS data. Those sirens you hear are here in White Plains, New York, and I'd mute it, but then you wouldn't hear me either. So let's bear with me a minute. All right, that's a little better. I'm right across from the fire department here in White Plains, so you may hear some more. Next slide, please. Now, you know, for each of these measures, in order for states really, they'll set a target for them, but then to reach those targets, we really need programs that are effective, programs that work. We're very fortunate in that we've got a body of research that'll tell us what does work. Because no matter what the target is, if we're not adequately implementing a remedy, adequately funding it, adequately advertising it, we really will not see the full effectiveness of that countermeasure. So what we have are countermeasures that work. It's an annual document, NHTSA updates on programs that are effective, and we rate them. You know, these are easy to implement, some of the countermeasures, some are not so easy. Some we have a body of research on, some the jury is still out on, and we still need more research. But it's very well organized, and the states have that available to them as a resource. And the National Cooperative Highway Research Program really issued a complimentary document. This comes with through AASHTO on the effectiveness of these behavioral highway safety countermeasures. It takes it a step further and takes a look at the practicality of each of these countermeasures. Now, selecting the targets and strategies is an obligation that'll flow all the way down to the municipal level and project levels as well. So there are a lot of things that states will balance and weigh when they set targets. Trends that exist, we'll talk about that a little bit in a minute, evaluations on what works, anticipated levels of effort, economic conditions, realistic limitations on what can be achieved, legislative changes. You know, has there been a repeal of an important law? So, you know, the trend goes right out the window when that happens. And, you know, what about safety improvement on a continuous basis, always aiming for fewer deaths? Next slide, please. So we'll take a look at how states are developing targets now, and I'll offer some examples as well. Okay, so really there are three very, you know, common measures that we use and to organize data and track those core outcome measures that I mentioned. And they're all useful in their ways. They all have advantages under various circumstances, whether you're doing an annual 3-year or 5-year average, and each has disadvantages as well. And so we'll see in a little bit, you know, how we can use each of them, and then sometimes how we don't use them at all, on how other measures on intuition and really the history that we have with the program will help us set a target as well. It's not always going to be science. There'll be a little bit of art in setting a target, as we'll see. Next slide, please. This is a small state, so you can see there, you know, we're taking a look at unhelmeted motorcycle fatalities. And so don't bother so much with the formula. What you really want to look at, the numbers are tiny. You know, we're talking about, you know, 10 fatalities a year in you know, for unhelmeted motorcycle fatalities, small state. And you can see when we look at the annual data points, you get these varying numbers that go up and down. Is there one fatality or two fatality, you know, movements here? Sometimes a little bit more, but it looks like we're all over the place. Now, one of the methods you can use to look is establish a trend line. And so rather than looking at just the annual number, take a look at unhelmeted motorcycle deaths that rise and fall steeply, you know, over a period of 3 years, for example. So this data smoothing device can really make the underlying trend easier to see. And so when we have low annual counts, and it even applies with some of the middle states and larger states as well, these sharp swings that we see from year to year can get smoothed out. And so that's the first thing we're asking every state to do, is to establish measures, but to use a moving average, because it'll give you a better picture of what the data is telling us. And so some states are using 3-year averages, others are using 5-year. Next slide, we'll see a 5-year average in the next slide with this same data. Now you can see what the 5-year average does. It smooths it out even further and gives you, it kind of dampens those distorting effects of the year-to-year swings. And so if you have one aberrant year or two aberrant years, we blend it in over a period of time. Now you still see the trend. It's an increasing trend, but it smooths it out. Now the disadvantage is we need more data. You know, when you're using 5-year averages, you got to go back, you know, in this case, all the way back to 2003. And so that's one disadvantage of using, you know, some data like that. Now, what we just did real quickly is show you how some states established those data points or those target measures and come up with a baseline. You know, let's look now a little bit about how we might forecast and come up with a target. Next slide, please. And this will be a large state example. If you look at the numbers just real quick over traffic fatalities, you might see it going down and then up between 2009 and 2010. But when we apply a 5-year average, you can see right away how it gets smoothed out, and we see, you know, a decreasing trend over time. And so that the one bad year, one aberrant year gets smoothed out when we look at, you know, traffic fatalities over a 5-year period. And there are many states that are moving towards this 5-year trend, the 5-year average. Same thing holds for unhelmeted motorcycle fatals and unrestrained. These are 3 of the target measures, performance measures, core measures that I described earlier that I have listed above. Those are the 3 activity measures listed below. And remember, we're not going to set a target for those activity measures. We're simply going to be reporting them in every state's highway safety plan. And so we get this consistent picture of every state, you know, that we can compare across the nation. So this is a great advantage, and we'll see tables like this in every HSP. Next slide, please. The next 3 slides are interesting in that I talked about the art and science of setting a target. So here we have motorcycle crashes, injuries, and fatalities. And basically it's a case here where the art and the science align very well. And so the state elected for that last data point for 2014 target to keep this 5-year trend, to keep the trend over this period, because it's a decreasing trend. It's not a severe decreasing trend that might be difficult to maintain, but it's a case of the science here, at least leading the state along to their final target, and it's achievable. It's realistic. It's something that everybody around the table can agree to and buy into, and they have countermeasures that can help. Remember, I spoke earlier about countermeasures that will help us achieve our targets, and so there's, you know, really a desk full of countermeasures that can help us get to where we want to go. Now let's look at the next one. This next slide is interesting in that we're looking at pedestrian fatalities, same state now. But what do we see? We see trends in the opposite direction. And so here's a case where the state has elected for a little bit of art to trump the science. The science shows us an upward trend, results in a forecast of continuing increases in crashes, fatals, and injuries. But the art, in this case, reality of public policy, politics, the optics of all of this, tells us, the highway safety professionals and the leaders, to establish targets below the current levels. It's just a pragmatic decision. We have science that says we're going up, but we don't want to publish documents. Go public with a document for our leaders to say, you know, our target is to increase fatalities in this particular measure. So there's a lot that goes, it's not just the math we're going to be considering here. We're looking at both, and this is a pragmatic decision now to say, you know what, we've got to look in that desk drawer for countermeasures to reduce pedestrian fatals. So it was a good thing. We have a trend, but we also know it's something we have to address with more resources. We cannot simply keep doing what we've been doing and expect a different result. So let's look at other cities, other states that are having success with pedestrian crashes, see what they're doing, and try that next year. Pour more resources there. All right, next slide. This alcohol slide is showing us a trend decreasing, and we're all happy about that, but it's not reasonable nor realistic nor pragmatic to expect these severe types of decreases over a longer period. So a happy medium here is struck between the art and the science. This is a trend line. Relatively steep drop in the three measures we're looking at: related crashes, injuries, and fatalities. But yet our policymakers, highway safety professionals, realize such a steep decline can't be maintained year after year. It's not practical, and we can't expect to continue at this steep decline. So we want to smooth it out a bit, establish targets that continue to decline, but at a slower, more reasonable, realistic rate. And in this case, you'll notice the state selected a target that is slightly above where the trend is indicating they should be in 2014. And so that's basically three examples of how a state sets some targets for the future, using both the math and the science of it, but also their knowledge and experience as well, and for practical purposes, setting targets. Next slide. Now these three slides, just quickly look at the annual counts. You can see they go up, they go down across time. Then we have the 3-year averages, smooth it out again. Beginning in 2001, we've got a steady decline, down through the years, where if we looked at just the annual data points, we wouldn't see something like that. And so, this is useful for medium-sized to larger-sized states to start using averages. Next slide. And that's all up to the state on how they do it. Now, you have those counts here, but the next slide will show us, that formula, this least squares. I think the next, if you just click it, it may show a formula. I don't know if you want to try that. Try to advance just one. Okay. And so that straight line you see is something that PowerPoint does for us, and this is something beyond me, and so our statisticians in the office will help us with this. But you see the trend line as continuing to decline. So in simple terms, the advantage here is this line best fits this up and down graph. So we have that example of a state just projecting out. The next slide will show us where they project out based on that line. And so this is a medium-sized state that looks at the science. This is just math now, using this least squares, showed us a trend that in 2014 we ought to be here. But what did they do? And this is really interesting. Let's look at the next slide, because a lot of states are using this measure. If you look at it just quick, those thick lines at the other end are actual data. So we have a 3-year average, that dark blue line. We've got yearly fatalities, the dark red line. We've got towards zero deaths projection goals. Okay, that's a green line. Now there's probably 20 states or so, maybe more, almost half states now, have adopted this towards zero death goal. You might say, well, gee, how is that? Is that evidence-based? Is that based on the science? But it's a vision. It's a vision that many states have embraced across America. And so what they would like to do here, and this is with AASHTO, with the engineers that embrace this, they say we'd like to see a 50% reduction in our fatalities by the year 2030. And so now they back away from that. And by the year 2015, they set the goal, which is even half. And they just simply geometric work their way back. What do we have to reduce every year to get to this goal by 2015? And then by 2030, have half as many fatals by 2030 as we have today. And so the current average is 497 if you look at a 3-year average that I showed you earlier, and we have 475 as our goal for 2015. That was a more practical goal. This is a towards zero death policy, a vision, if you will, where the state elected to say, we have a linear trend, that blue line, we have a linear annual, the blue line's a 3-year trend, but we don't think it's practical from where we are today. But we do think, based on what we know, the knowledge we have in this program, again, this art of it all, it's not really art, and you're not pulling numbers out of the air. You're basing it on your knowledge that you have of the program. We say our towards zero death goal is more realistic. We're going with 475. And so those were some examples. And the last thing I'll say before California comes up is, there's so many books we read about statistics, and we know what we can say with statistics. And there's this thing about the trend lines will tell us, where we'll be, and all it is an educated guess, really. And it's assuming that everything is equal, present trends continue, and we all know life isn't like that. Present trends and all things rarely stay equal. It's a dynamic situation we live in. And so the idea that we'll just rely on a trend, we know we're going to have to balance it with a practical decision. And so that's our part of it from NHTSA, and we're so pleased to have the California Office of Transportation Safety with us. They've provided leadership on benchmarking and targeting for many years, and they've done some remarkable work on performance measurement and target setting. And so I believe it's Dave Doucette and Karen Coyle with us today with the next slides.
Thank you, Tom, and on behalf of the California Office of Traffic Safety, a big thank you to NCSL for giving us the opportunity. And again, we truly appreciate the partnership we have with NHTSA. Without our federal partners here, we would not be able to do the work that we do. Tom just gave you a great overview of what's going on nationally. We're going to try to break this down and give you some specifics of what happens here in California. With me is Karen Coyle, and she just recently went through the process of MAP-21, going through our performance measurements and things like that. So she's going to give you specific details. Before I turn it over to Karen, I do want to mention, California is a state of nearly 40 million people, and we're looking at some numbers here, and you're going to see some specific numbers of California. We're here to save lives, and just keep in mind each one of these numbers is a face. So what we do and the partnerships that we have throughout the country and throughout California are so valuable, and we work each and every day to try to keep the numbers down. So with that, I do want to turn it over to Karen, and she's going to go over a few slides, and then I'll come back and talk about a few more slides. Next slide, please.
To provide everybody a little bit of background, like Dave said, I've been working on our state's highway safety plan for the past 6 years or so. California has been setting goals for the core performance measures outlined by DHSA and NHTSA since 2009, and California also sets other targets for other performance measures in our highway safety plan. They also directly tie to our state's strategic highway safety plan. So our performance measures have always been data-driven. Up until this last year, Director Murphy and I have looked at all the statistics and the trends to determine the goal targets using our best judgment. But as Barb and Tom both mentioned that, this year with the MAP-21, the states have had to use a more scientific and data-driven approach, and also provide a written justification for each target goal. NHTSA put on a webinar about performance measures and trend analysis. It was very, very complex. I think it was kind of like statistics. It wasn't 101. It was above my head, actually. And after sitting through that, I went back to my desk and we started going through all the charts that we've used in the past, and we started adding these trend lines to the data charts in Excel. And I didn't have a research or extensive statistics background, so I started calling some of the other states to find out how they were actually setting their performance measures and their targets. One of the things that I found out, one of the things that was a challenge for us, with not having all that expertise, some of the states actually used their grant-funded researchers at their universities to help them with their performance measures. So the other resource that I found very, very helpful was our NHTSA region office. Aubrey in our office did have an extensive statistical and Excel background, and so she was able to help me a lot when we transformed to these new charts. One of the other challenges that we came across over the last couple of months is that California didn't and still doesn't have current data for 2012. And so when you're looking at setting goals, having a year of missing data, was a challenge. We had some preliminary data, and I'll talk about that when we start looking at the slides. Another one of the challenges that we had was that, for the past few years, California has seen very big drops in total fatalities as well as alcohol-impaired fatalities, and now those numbers are starting to trend upward. And so, we looked at 3-year moving averages and the linear trend analysis, and most of the time, in most cases, it was just unlikely that we would hit our goal using that, the 3-year moving average. I mean, it did help smooth out the data, like Tom mentioned, but we kind of looked at our annual numbers when we looked at all of our performance measures. Next slide. So the next 3 slides, we have slides for traffic fatalities, alcohol impaired, and pedestrians. And this first slide, if you look at the top line, the green line, it shows the 3-year moving average starting from 2008. And then the blue line shows our annual numbers. And you can see where we've had like big drops since between 2008 and 2010. In 2010 through 2011, it increased about 3%. And our preliminary numbers are showing us that it's going to be another like 3.5% increase in 2012, even although we don't have the official numbers yet. The line that goes down the middle of the graph is our trend line, and so when we calculate it out using the formulas that we were shown by NHTSA, it shows that we would have another drop of another 351 fatalities by 2014. And so when we start looking at that as when we wrote our goal to decrease traffic fatalities from the moving average from 2011, that 2861, it just didn't seem realistic to us that we would hit the decrease by another 351 persons. And so what we decided would be more realistic was to decrease it by 1% to 2833. And as Tom mentioned, it was really hard for us to write this goal or in the target to show an increase, but we thought it would have been more unrealistic to think that decline would continue. So, next slide. I think back one more, the alcohol impaired. Okay, so this one, same type of thing, shows our moving average, our annual numbers, and then the trend line. And the trend line on this one also is showing, a steep decrease. And like Tom said, it's, there's so many other things that play into, what makes the numbers go up and down, and could be economy, could be our programs. I mean, we'd like to think that everything that we do, everything that we fund, all of our programs, whether it's the DUI checkpoints or selective traffic enforcement, child passenger safety education, and awareness for other traffic safety programs, we like to think that helps bring the numbers down. But we did have in 2010 and 2011 the exact same number of alcohol impaired driving fatalities, and although we think that's great, we think it's going to inch up just a little bit. So on this one, we set our goal to decrease fatalities 4% from the moving average to 792. Next slide. And this one is just another similar slide showing that on this one we're going to decrease fatalities 2% from the moving average, which at least on this one we did set our goal to be lower than the moving average and the annual numbers. So we're hoping to do something about pedestrians. Yeah.
Next slide, please. So what can be done, and what have we done here in California to help meet and exceed these performance measures? I mean, our vision, a lot of states' vision, is towards 0 deaths. You saw 3 examples of some of our performance measures and the numbers there. Quite quite large numbers in terms of fatalities, but there has been some great decreases, and we continue to work hard. And how we do this is with the great partnerships that we have. On the slide that you're looking at now, these are laws that have been passed in California, and I'll just go over a couple of them and kind of tell you what other states are doing as well. The primary seatbelt laws that apply to all occupants in all seating positions. Currently, 16 states have primary seatbelt laws for all occupants in all seating positions. Another law, the Universal Motorcycle Helmet Law for all riders. Currently, there's 19 states that have a universal helmet law. The next one here, to amend statutes to provide separate and distinct sanctions for alcohol and drug-impaired driving that could be applied individually or in combination to a single case. There's three states currently, California, New York, and Hawaii, that have statutes like that. The last one on here, the sobriety checkpoints, one of the best practices that is endorsed by NHTSA. Currently, 38 states conduct sobriety checkpoints. So all of these here we do in California, and these laws have helped us to achieve, enable to reduce deaths. All the laws, and if you can go to the next slide as well. There we go. All of these laws are supported by the Governor's Highway Safety Association. GHSA.org is a website you can go to. These are some additional laws that not all of these are currently in California, but some are and some aren't. I just wanted to mention just a couple on this slide. The second one, drug per se, zero tolerance drug impairment laws. That's one that GHSA supports. A couple other ones here, handheld cell phone use and texting bans for all drivers, as well as all cell phone use ban for novice drivers. The novice driver law, currently 37 states have an all cell phone use ban for novice drivers. So again, these are just additional laws that can be passed. They all are supported by the Governor's Highway Safety Association. I encourage you to go to their website for a lot of this information. But with these partnerships that we're talking about in the passing of these laws is really what helps us, reduce our deaths and fatalities and injuries here in California. And it's, again, every death that we have, some of these numbers is a face, and our goal is towards zero deaths because everyone does count. So with that, I believe I'm going to turn it back over to NHTSA to kind of wrap the slides up.
Well, thank you, Dave. I think the important point, that California and Dave made was that we can't set goals alone. This is setting goals and targets really is a collaborative effort, and the hard work of many organizations and associations must be considered on whether we can continue to make progress or that progress will be slowed down. So all the multiple targets that, as you can see in this very busy chart, that feed into the state's strategic highway safety plan there in the middle, the commercial motor vehicle safety plan, the highway safety plan we spoke about earlier, the highway safety improvement program, which is a DOT-based program in each state, and then metropolitan planning organizations. There are a whole variety of them that take around the state that have to be considered, and so all their activities really feed back into the strategic highway safety plan in setting those goals. And so it's going to take that collaborative effort to move forward. And legislation is a very important part of it, as Dave mentioned. And so that's something that has to be balanced and measured in every state. Next slide, finally, please. And so, what we've gone over during this webinar, really, we looked at trends. We looked at being pragmatic when we make these evaluations and deciding on where we'll go. Be realistic, but don't forget there'll be economic conditions, legislation, and permission, both from the public and the political permission needed to move ahead. But that's a role that everybody can play in providing enough resources to do what we want to do, to fund the countermeasures that work, to sit at the table and have the conversation with the decision makers in each state, and to provide that kind of forum and support to move us in the direction to get whatever is possible in each state, both politically and from the public. And so that's really the role, to be partners together in all of this. I see us all playing together to move ahead, just to make our issues much more visible It is the big driver of injury in nearly every state, and it's certainly worth everybody's attention and concern. So thank you.
Thank you. Now I would like to open it up for questions from the audience. And remember, you can type a question into the box at any time. Our first question that we have here is, I understand that the highway safety plans were due to NHTSA on July 1st. When will these be available for the public to review and see how states are setting goals and allocating resources?
And this is Barbara Sowers. I can take that. Our regional offices have until September 1st to approve the highway safety plans. So it's about this time that we then move those plans to our IT office, who will begin to post them on the NHTSA website. I think it takes them a couple of months to get that done. Quite frankly, there's a lot of coding that needs to be done to make these compliant for web-based use.
Great, thank you. And as far as timing, when is the best time to meet with state highway safety offices to discuss programming?
Well, I could try that, and California could add, their timing. The states in my region, all start planning very early in the year. So, most of our states require that, grant applications be in by early May. And don't forget, they have to submit the plan to NHTSA by July 1st. So have the conversations early on in the year, and that money starts to get committed to projects very early on. So I'd say the first quarter of every year is a good time to start sitting around the table. You'll be invited, for ideas and how you can contribute to achieving targets, what you can do to complement the programs that are going on in the states. California, I don't know what the timing is like.
Thanks, Tom. In California, we start a little bit earlier than that. It's really a year-round process for us. So I encourage you to talk with the highway safety offices whenever possible. As we're getting ready to start fiscal year 2014 here next month, but we're already looking at 2015. So we kind of look at it year-round, but our process, we go in January is about when we start receiving our applications as a deadline.
Great, thank you. Are there any more questions from any of the audience members? Well, I wanted to make an announcement that the webinar will be posted online at ncsl.org, and we will also be sending all of our participants an email with the link for that. And I'd like to thank you for joining us today for our NCSL's MAP-21 Performance Measures, the Future of Federal Traffic Safety Grant Funding webinar.